What's going on, y'all? It's your boy Mike here with another video. Look like a hot mess. Just got out of the gym. When I was working out, I was thinking about something that I've never really talked about, and it's pretty much how to survive PTA school. Coming from someone who struggled in PTA school, but had to learn. I learned a lot. I learned how to adapt, and I'm just gonna tell you guys what worked for me, and hopefully this helps you guys out. So the first thing I'll say about PTA school, it may be similar for PT school, I'm not 100% sure, but the first thing I'll say about PTA school, learn, I call them your OINs, your OIANs, your origins, insertions, activation, and your nerves. Those things will follow you constantly. Know your OINs. My PTA school was 5 semesters. And the amount of times I was asked, sorry, I had to turn my AC on. The amount of times I was asked, what's the nerve that controls the brachialis? You would be surprised. I was so many times like, oh, what's like piriformis? What nerve does this? What nerve does this? You will be surprised how often you get asked those things. So, learn your OINs, your OIANs. Learn them, memorize them. Tooth fairy, whatever you gotta do. Write it on a note card. Sleep on it. Learn your OINs. Those things will follow you for the rest of your life in PTA school. And practice, depending on where you're practicing at. Whether if you're ortho, if you're acute care, if you're outpatient, depending on what setting that you're in, you'll still have to deal with those a little bit. I don't have to deal with them too much because I work mainly cardiac acute care, so I don't have to deal with those as much as an outpatient ortho would. But there's still times I'll have to know those things. Another thing I'll say is this actually helps out with exercise also. Where the weight is coming from. The action is different than what the muscle is doing. For instance, you see this all the time in the gym. If someone's trying to work out their rotator cuffs, they have the dumbbell here and they're swinging this way. They're swinging this way. Yes, but where's gravity? Gravity's pointing down this way. So if your arm is here, you're working your bicep. You're not working your rotator cuffs. If gravity is coming from this way, whether it's a pulley, a TheraBand, or something like that, then this is working your rotator cuffs. But having a dumbbell like this, that's not working your rotator cuffs. Gravity is pointing down, so pay attention to where gravity is coming from. Now, if you want to do that exercise with a dumbbell, you have to lay on your side, and then you have to do external. Does that make sense? So pay attention to where gravity is coming from. It'll make things a lot easier. Why does this work this way? Why does this work this way? Where's gravity coming from? Where's gravity coming from? So that will help out a lot also. Another thing I'll say is find a good study group. To be honest, the study group that I found saved my life. No lie. They saved my life. I almost failed out PTA school twice. The first time I failed out PTA school, again, it was because of my OINs. It was the first semester. I was struggling. My teacher's like, what can we do to make sure that you pass? And this is why I have so much respect for my program directors, for my teachers. I have so much respect to the point that my program director was actually one of my committee members for my doctoral practicum. So much respect for him. But what I did is I told him I'm gonna stop working out for a while. I'm just gonna focus on my OINs. No lie, I wrote down every OIN that I knew 100 times, minimum a week. It's like, no, we're on a break. What are you doing, Michael? I'm doing my reps. OINs. Michael, what are you doing? What are my OINs? The first thing that you have to learn is your bones. So you have to learn your bones. Your fissures, your bony prominences, how many bones are on the body, your DIPs, your PIPs, all these different things, your phalanges, your carpals, your metacarpals, your tarsals, your metatarsals, your calcaneus, all these different bones in your body, your humerus, your femur, your tibia, your fibula, your parietal bone, your maxilla, your mandible. All these different bones you'll have to learn. There's a lot of bones in the body. Your clavicles, you have to learn all those different prominences. Why this does this? Why this does this? You have to learn all of those things. So that's what you're going to learn in your first semester. Your bones, your bony prominences, things like that. That was actually the first practicum that we had. And no lie, we had a class, like we had to stand outside the class. There's probably 5 rows of tables. There's like 50 or 60 questions, and they're just bones in the classroom, just bones laid out, and there's a note card, and they'll either say, what bone is this, or what bony prominence is this, or where does this connect to, where's your acetabulum, all these different things. So you'll have to learn those a lot. And when you're getting to practice, depending on what setting that you're in, you'll kind of pay attention to those things a little bit more. However, you still have to know those. All these different bones, all these, like, and when it comes to your spine, bro, oh my gosh, the spine is a monster. The spine is a monster, bro. So you have to learn all these different bony prominences, why this does this and this does this. That's more than likely that's gonna be your first semester. That's how it was for my first semester. We had a lot of ortho stuff. So learn your bones, learn your Owens, find a good study group. Again, my study group. So first semester, my Owens is what I struggled with. I literally stopped working out. And again, I just came from the gym. I'm the guy that can work out 5 days a week for 2 hours and have a field day. So for me to stop working out for like 2 months just to focus on school, that's a lot for me. I stopped working out. I stopped playing video games. I have to get the stuff done. I was like, I have to. And on the final, I literally got to the 10th decimal where I needed to pass. So learn your Owens, because no lie, the 5th semester of school, I went to go visit my teacher. He was like, hey Michael, no, what's the nerve for this muscle? I was like, really, doc? He's like, so they will trick you, and they'll play with you like that. It's if you have a good program director, good teachers, they want you to learn, but they also like play jokes and stuff like that, because they want you to learn. They want you to be there. They want you to be a successful practitioner, because you'll go from student to colleague, in a relatively short amount of time. In 2.5 years, you'll go from student to colleague. So time flies in your PTA program. So pay attention to gravity. The 4th semester I was in, my teacher again, she's like, Michael, your grades aren't looking good. I was like, yes ma'am. What I did, I found a study group. Because of my study group, I went from, Michael, your grades aren't doing good, to going on the dean's list. Fine. If you've never studied with a study group, try it out. Just try it out. You get different perspectives and things like that. I was with the study group in my 4th semester and my 5th semester, and studying for boards, for our law exam and for the state boards. Yeah, we have a law exam. Different states have different requirements for the law exam. Some states have open books. Some you can take them at home. Ours, you actually had to go to a testing facility. An open book, it was a testing facility. For your board exam, each state has different rules also. So pay attention to the rules of the board exam for your state. Some states have like compact licenses, some don't. I know that for Florida, because I'm in Florida, we do not have a compact license, and I think you have, if I'm not mistaken, it's 3 chances to pass. The first time, if you take it and you don't pass it, you can take it again. The second time, if you don't pass it, you can take a class or something like that, like to learn like what you did wrong, so on and so forth. The third time, if you don't pass it, you're not allowed to take it again in Florida. You're not allowed to practice in Florida. Now, let's say if you're in a state where you have 5 attempts and you pass the board on your 4th time. If you come to Florida, if I'm not mistaken, because you pass it on the 4th time, you're not allowed to practice in Florida. So double check with your state, double check licensure regulations and rules and everything like that, just to make sure. But again, Florida can be a little funky sometimes. So that's what I'm saying that. So pay attention to those things. The law exam was kind of weird. It's interesting. There's a lot to law. Yeah, we need to know some state laws for PTA. Go figure. Um, so have a good study group, because a good study group will they'll help push you. When you're going to your boards, I'll probably make a video about about boards and things like that. Even though it's been a while, there's still some things I remember about my boards I can still chat with you guys about. But have a good study plan for your boards. I would definitely say that. With neuro was a tough one. I would say find as many mnemonics as you can and make it as interesting of a story as you can, because that's what we had to do, because we were talking about the left side of the brain and the right side of the brain, how different hemispheres have different personality types, and you act differently with different hemispheres. So I think it was left side Lucas and right side Ryan. It was out of 30 students, there's four guys. So I was with all girls, and it was like Dawson's Creek or something like that they were talking about. It was interesting, but hey, I learned a lot. And ladies, I appreciate y'all, because if it wasn't for y'all, I want to be here. So I appreciate you, ladies. But find mnemonics. Find something that's going to make it stick for you. Whether it's a mnemonic, whether you're trying to tie it with your favorite TV show or video game, music, or whatever you can tie it to, tie those things together. Because there is so much information in PTA school, it's not even funny. Less than PT school, obviously, but it's a lot of information. We had this book, we call it the Big Red Book. No lie, that book is this big. Literally this big. I still have it. That book is this big. That's one of our textbooks. We had that. We had a Therex book, which is Therex's therapeutic exercises, which is about this big. So not as big, but still pretty hefty of a book. Some books I would say definitely buy. Some things I would say borrow from people. If you want to, there's still good information in it, whether if you're in practice or whether if you're just like to exercise, there's still a lot of information you can learn from those books. So if you're like, hey, I want to just improve being a better person in the gym, I want to be able to educate people better, I want to be able to coach people better, whatever your realm is, that's why you'll need different books. To be honest, I have some classmates that don't even practice. One of my classmates, he actually runs what is it called? More like a he's a different kind of personal trainer. It's like more like he used to do like more animalistic type motions, but he does like more full body motions, trying to just get like everything connected. So not so much as a traditional lifting, but more of like a mixture of martial arts plus lifting plus rehab plus combining everything, the rotation aspect, the bending, the lifting, the twisting. It's like a full body type exercise. Another one of my classmates is a professional dancer, and she used some of her information that she got from here to improve her dancing. Also, she also runs a coaching business and something else. Another one of my classmates I've seen recently, she does therapy for CrossFit athletes. So there's a lot of things that you can do. You don't have to just as a PTA, you don't have to just practice, in a outpatient clinic or just in a hospital. Something that I found that was interesting is actually as PTAs, we can actually work in dentist's office. TMJ, it's a joint. You have muscles. So technically speaking, PTAs can work in dentist's office. If you didn't know that. Another thing is that I think you have to approval by dentists and things like that. I'm not sure if you have to have it approval by PT, how that's going to work exactly. But yeah, PTAs can work in dentist's office. If I'm, fact check me, but I'm pretty sure they can, which I found pretty interesting. Another thing, we can do therapy on animals. So if you don't want to work with people, if you want to practice, study under a vet for a little bit, because again, animals have muscles. Animals have muscles. Again, the treatment is a little bit different, obviously speaking, because a horse is much bigger than a person. So, you probably have to get some shadowing under a vet or a vet tech or something of that nature, in order to work on animals. But PTs and PTAs can technically work on animals, technically speaking. So if you don't want to work on people, that's another avenue you can go into. So that's another thing you can do. Another thing I'll say with PTA school is know why you want to go into PTA school. Do you want to Is this a stepping stone for you? Do you want to eventually go to PT school? Like, what are your goals for PTA school? Whenever I started when I went to PTA school, I was like, yeah, I want to be a PTA. No. But I also, whenever I'm anywhere doing any kind of job, while I'm doing my job, I treat it as on-the-job training also. So I'm not just doing my job, I'm learning from other people. I'm asking other people questions, just trying to pick people's brains, just trying to understand, like, different avenues and different routes to, to different career paths. Again, even though I was a PTA, went to school for PTA, I was still asking people, like, why'd you go PT? Would you want to go PTA instead of PT? Why'd you go OT? Even though I was in OT school, I still ask people that. I still talk to the speech language pathologist. I get to talk to a lot of the PAs because they were really, really busy and running around, and I don't think anyone paid attention to me, to be honest. But sometimes they're like, oh yeah, PT's here, make sure you do your PT. We're talking to the patients like hey, doc said do your PT, so do your PT. But understand why you're going into PTA school. It's not there are times, I'll admit, there are times that it's a little bit easier than other times. But there are times where it's just like, why am I doing this? There are times where it's really tough. Again, y'all may be super geniuses, but as for me in my house, I ain't a genius. I just work hard. I'm just stubborn. That's it. I'm just stubborn with my progress. So know why you're going to PTA school. Remember, I was talking to one PTA. She was pretty much one of my mentors, and she said that one of her classmates got into like the 5th semester PTA school, and they dropped out because they didn't like feet. What? I digress. So, do we have to do it with feet? Yeah, we gotta do it with feet. People need to put socks on. People need to put shoes on in the hospital. Now, granted, that's usually OT will kind of do that stuff. But if we're walking a patient and there's no OT, teaching about dressing and things like that, why can't we teach about dressing? So there are times where we gotta do it feet. There are times I'm sitting there brushing people's hair. Because there's a lot about PT. That's another thing I want to talk about. And as a health coach, there's something that we have called motivational interviewing. So you're asking questions to kind of like just dig into why people do certain things, and use the same thing in PT and PTA and therapy. We're just not taught that it's called that. And once you understand that, you can get a lot out of your patients. There's times I'm just like, what do you want to do for therapy? It's like we have our general goals for therapy, but what do you want to do? Because like our general goals are to get you up and walking. If they're ambulatory, if they can walk. I'm like, our main goals are to get you up and walking. But what do you want to do? Because in the hospital, you don't have a lot to say what you do. So I'm like, what do you want to do? And someone's like, yeah, I want to walk now. Okay, perfect. Let's go walk. No, we go outside, like, you want to walk this way or this way? And I'm just talking to people and just understanding their why. Because if you can relate it to something that they want, if you can relate why you're doing therapy to what someone wants, you'll get so much more of your patients. Instead of just saying, do this, if you can relate it to something that makes sense to them, what their why is, just like with school, like why you're in therapy, like why you're in therapy school. You can do so many other things. You can go into respiratory therapy school. You can go into nursing school. You can go into business. You can go into electrical engineering. But why therapy? Same thing with your patients. Ask them their why, and it will help you out in practice a lot. So understand your why of why you're in therapy school, why you're in physical therapy school. So there's so many other things that you can do. What is your why? Why are you doing this? Why are you learning about all these bones and muscles and tissues and pain receptors and nerves and the supravena cava and all in the left ventricle and right ventricle and the aorta, and why are you learning all these random things? Why are you learning about dermatones and all these other things? Like, why? There's so many other things you can do with your time. So understand your why about physical therapy school and physical therapy assistant school, because when it gets tough, not if, when it gets tough, you're like, why am I doing this? Particularly with PT school, because again, PT school is a doctorate. PTA school is an associate. Now, just because it's associates doesn't mean that it's not hard. because PTA school is tough. So understand your why you're doing this. Do you want to be a PTA? Do you want to go on a PT school? Do you want to use it as on-the-job training? Do you want to do you want to improve? If you're a personal trainer, do you want to improve your personal training? If you're an athletic trainer, do you want to understand the therapy side of athletic training? Are you using this as a stepping stone for something else? Or do you want to just be the best PTA you can be? Understand your why and embrace it, because that's going to make you so much better of a therapist, whenever you're done with school. I'm trying to think what else is going to be beneficial for PTA school. There's a lot of things that can help. Talk to your teachers. Make sure you talk to your teachers. They're your teachers, but they're humans too. If there's something that's wrong, talk to your teachers, because they're not mind readers. They're humans. They're people. And just like I said, I've known my program director. I've known him for 9 years. And I met him because I was doing therapy. I was a rehab tech, and one of the PTA students, they were working with one of my mentors, and so we just started talking and everything like that. And I was like, talking about school and everything, blah blah blah. So then I was applying, and I was like, the first semester I didn't get in. The second time I was like, no, the first time I didn't get in. And then I was like, okay, what can I do it again next time? So on and so forth. He's like, yeah, do this, and this. The second semester I applied, but I got into OT school first. I said, hey, I applied to your program. I just wanted to let you know I actually got to OT school. I just want to thank you for your time. So on and so forth. He said, no, thank you for letting me know. Blah 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 blah. And as y'all know, if y'all watched the video, I failed out of OT school. I'm afraid to admit it. I failed out of OT school because there are a lot of things that I didn't do then that I did in PTA school. So the third time I applied, as I told him, I was like, hey, I failed out of PTA school. I failed out of OT school. Can I get into your program? He's like, yeah, do this, this, and this. I'm like, all right, dope. I did this, and this. And we've been cool ever since 2015-ish. Because 2015 was the first time I applied. 2016 I got into OT school. 2017 was when I actually started the program. We've been cool since then. And I said, a couple weeks ago I actually went and dropped off a gift for him because he was one of my community members. So talk to your teachers. They're people. They want you to pass. They're there for you. Generally speaking, some teachers aren't the nicest people in the world. I'll put it nicely. But generally speaking, your teachers want you to pass. They want you to be the best therapist that you can be. So talk to your teachers. But those are some of the big things I can say about PTA school. Another thing, have fun. Have fun, because these people you're gonna laugh with. Sometimes you're gonna cry with them. You're gonna be pissed off with them. But they're gonna be your family for two and a half years. Depending on the program, because there are some accelerated programs that are like 18 months, but you're doing a lot. And a lot of the CIs I know, clinical instructors, they're like, we don't recommend those programs. They're there, and not everyone is bad, but there's a lot of things that just get crammed in. So they're there. Depends on what you want to do, but there's a lot of programs out there. So that's all I can think of off the top of my head. If there's anything else, I can drop another video. I may make a video about how I passed the boards on the first time. So that was an interesting one. So talk about the law exam and things like that. Obviously, I can't give out too much information because legal. But I'll probably talk about some stuff about like how to pass the boards and different things like that. But if there's anything else you guys want me to talk about, let me know. If you want me to drop more videos about being a therapist, about being a health coach, about early management stuff, let me know. I think that's a good video about things I learned being a young manager. Probably drop a video about that. But that's what I got for you guys. But until next time, later.